Conversations with Cathy.
Good evening, Miss Cathy. Thank you very much
Hello.
for that kind introduction.
Yes, naman. Of course, you're like, when I listen to, lectures, I will say that you are one of the best teachers, that I've listened to. Really. And
Yeah.
I say that in all honesty. So, you're so, our audience, basta. You will see, as we go along this evening. And like I said, listening to our conversations because we still have 8 packs to give away tonight. Okay.
Right. Okay.
Let's start. Let's begin. How is
Sure.
Alzheimer's? How is Alzheimer's? Oh, and I have to say, I like the color of your shirt. I know that's well,
Okay.
that's the
Thank
color
you.
of Alzheimer's
Yes.
Alzheimer's month. So first
Yes.
of all,
Purple.
yeah, how is Alzheimer's different from dementia? Can you explain that to us and describe? I know there are also different types of dementia.
Right. Dementia is the umbrella term. No. Although technically now in clinical speak, we use the term neurocognitive disorder, but dementia would be the general term when you talk about someone who has problems with their cognitive functioning. Alzheimer's disease is a type of dementia. So there are several types. You have frontal lobe disease, and then you have vascular dementia, which is the second most common. But since Alzheimer's dementia accounts for about 70 to 75, even 80% of all forms of dementias that are clinically recognized, then so the terms become interchangeable. So when you say someone has Alzheimer, it's understood that they have dementia. And when you say dementia, people assume that you're referring to Alzheimer's disease. Okay.
Okay. Um, Can you like siguro very quickly lang differentiate one type of dementia from the other? You mentioned
Vascular. Okay. Yeah.
frontovascular.
Okay. Yes. They vary essentially in terms of yung pathology. What is the problem in the brain? For example, with Alzheimer's dementia kasi nagkakaroon ng parang scar tissues inside the brain sa
Okay.
brain matter, and that's the one that disrupts yung nerve transmission, no? And that can account for the manifestation of the patient. The second most common type is what we call vascular dementia. It's due to small strokes in the brain. Kasi the usual, when we think of strokes, may mga malalaking stroke na it leads to, let's say, paralysis, ganon. But sometimes the strokes are so small, no, that they may not have physical manifestations, but their manifestations are primarily in terms of how they think, no. So, that's what we call vascular dementia. Tapos the other ones like frontal lobe dementia, kasi may mga small sort of lesions in the frontal lobe of the brain. So may mga iba-ibang klase, no? But because we deal primarily with Alzheimer's and vascular dementia, kaya yung iba, they're not very common, they're kind of rare. Kaya hindi sila masyadong nabibigyang atensyon. Okay. But in clinical practice naman din kasi, most of the time, I mean, like in 8 out of 10 cases, we would deal with a patient with Alzheimer's
With
dementia.
Alzheimer's, no? Yes. Yeah, before I go on, if you have questions or concerns regarding Alzheimer's, dementia, we'll try to answer them. So just, write them down in the comment section. Okay, my next question. Will everyone get dementia at some point? How does this,
No,
sorry, yeah, go ahead.
fortunately not. Okay. If we look at the overall incidence, like what you were mentioning about statistics from the WHO, no?
Yes,
Uh, essentially less than 10% of the elderly population will develop a form of dementia. So that's so kumbaga 1 out of 10, ano, ang chance
right,
nila.
right.
And that's just referring to the elderly population. So that means that majority of individuals when we grow older, we will remain more or less cognitively intact. No?
Oh,
I mean we will probably have minor cognitive problems, no, but very few of us will develop a form of dementia, which is
okay.
great news, di ba?
Yes, yes, definitely. So, which brings me to a similar question that is being asked here. See, let's talk about risk factors.
Okay.
What are some of the risk factors?
Mhm. Marami eh. But since we commonly see dementia in the older age population, so we
Oops. I think Doc Bong froze. Yeah. Okay, we'll get back. So I think there's just siguro some slight technical difficulty. We hope to get him back. So like, if I were to recap what Dr. Bong said, let me just pull out my notes. So not everybody is going to get dementia. No, it's not a thing that that lahat tayo we're going to get it at some point. He said 1 in 10, but not everyone. There's normal memory loss due to aging, and there's dementia, which is actually a disease. So we just heard back from Dr. Bong. He's just refreshing his connection. Also, he said there were, I think, 4 types, right, of dementia. If you recall, Robin Williams was supposed to have suffered from Lewy body dementia, which is, I think, one of the rarer forms of dementia. Alzheimer's being the most common one. He said 70 to 80% of dementia cases are actually Alzheimer's. So, we still haven't gotten him back. So, okay, let's now ask questions na lang while he's not yet back here. So, okay, Cholo, can you kindly flash our next question? Alzheimer's is a form of dementia. True or false? Okay. So just send in your answers in the comment section. Alzheimer's is a form of dementia. True or false? O, di ba? Pinlash mo pa ang nandun sa loob ng clean there. So, okay. Well, Alzheimer's is a form of dementia. Yes, it's true that Alzheimer's is a form of dementia. And our top 2 first winners is Ana Mendoza Reyes and Ina Reyes. Ako, pareha silang Reyes. Okay, please send us a message to our Facebook page, Conversations with Cathy. Send us your details, your name, your address, your contact number, and we will send the clean package to you. Okay. So, Cholo, how is Dr. Bong doing? Is he still refreshing? Still refreshing his connection? Okay, okay. So we already discussed I think no, we cannot ask the third question yet because we were in the process of discussing. So I am seeing some questions here. Let me try to answer some of them from what I know, and then Dr. Bong will just validate it later on. So Joy Ann is asking, is there such a thing as early onset Alzheimer's? Yes, I know there is such a thing as early onset Alzheimer's, which ties into the question, is Alzheimer's hereditary? I know that the early onset type, which is the one that hits you when you're in your 50s, that has, like, I believe, a strong hereditary component. Sorry, Doc Bong, sinagot ko na yung ibang tanong. I-validate mo na lang mamaya kung tama yung mga pinagsasabi ko.
I'm sure they were correct.
Yeah, so before you got cut, we were talking about risk factors, right?
Yes,
okay. Yeah.
Yep. So age, the older we get, tapos generally bad habits, like smoking and drinking. Right. And a long time ago, the WHO said that there are 2 medical factors that increase the risk for dementia, which would include diabetes and hypertension. So especially if they're uncontrolled, So that's one reason why countries all over the world paid particular attention to controlling diabetes and hypertension. And actually, it has in the last 10 years, they've seen an improvement. In Western countries in particular, the incidence of dementia is going down. Okay, But in third world countries, in low and middle income countries, the incidence is still relatively high.
Going up. So that
Mm.
includes us, right?
Yes, that includes us.
That includes us, yeah. Wow, ang daming tanong, Doc Bong. So we
I,
better, yeah. But just to emphasize, what is the biggest risk factor for dementia again? Age, correct?
age,
Age,
yes.
no? Age,
Old
yeah.
age, well, old age in particular, yes.
Right. And I know alcohol also, but yeah, alcohol is a risk factor. How is that a risk factor? Can you
Pero
talk
hindi yung clean, no? Hindi yung rubbing
about
alcohol.
hindi. Yeah.
Baka magalit ang Filusa. Okay. How is that? Well, kasi, well, okay, let me rephrase that. It's not drinking alcohol per se because as you know, may mga recommended amounts naman talaga. Okay.
Yes.
So when you say alcohol and smoking, these are when these vices, like say, are used excessively or outside the degree of moderation. So therefore, then hindi lang naman sa hindi lang naman sa Alzheimer. I mean, in any other parts of the body, maapektuhan din nila, no?
Yes.
Liver, kidneys, heart,
Right.
no. So, and that's the reason why we do encourage people to limit their alcohol and smoking intake,
Yes.
cigarette intake.
That's true. Yeah, it affects so many things, not just Alzheimer's.
Right.
Okay,
Right.
so before you were gone briefly, Joy Ann Lara asked, is there such a thing as early onset Alzheimer's?
Yes, there is. Generally kasi when we say Alzheimer's dementia, we sabi ko nga 'di ba old age. So we generally see it after the age of 60. Pero
Okay.
merong type kasi dalawa lang naman yan, basically early onset or late onset.
Right.
Late onset is the one that's more typical, no.
Yes.
Yung late onset dementia would of course generally appear in middle age or late middle age. And this is the one that has a more familial or hereditary component, no? Unlike yung late onset, which is somewhat what we call idiopathic, no known etiology, except mainly tumatanda na lang talaga, or there were other factors concerned. No?
Yeah, so tama pala. I sort of answered it that way. So thank you for validating it. That the early onset has a strong familial or hereditary component, right? Okay.
Right.
Yeah. So yeah, our friend Alia Hunasan said, "Is there anything?"
Hi, Alia.
Oh yeah, Is there anything we can do to prevent this from happening in our 50s? So I guess ito nga yung sinasabing early onset.
Pag early onset, of course, it would help to be able to identify if you have the gene for that, and that's the reason why, for example, in other countries, in Western countries in particular, they can do gene testing. In the Philippines, we can, but there will probably be one or two companies that can do genetic testing, but I think they would still send the specimen in other countries. Usually Hong Kong would be the nearest to be able to do the analysis because it's a bit expensive, no? Yes. So you would, if you have a, okay, ganito din. And when we talk about genetic risk, kasi, I'm talking about first degree relatives. So that would be your parents, no?
Yes.
Your biological parents. If they develop, then yung risk mo mataas. Pero kung let's say uncle mo yan or grandparent mo yan, may konting risk pero not as significant if the person we're dealing with is either one or your parents. Of course, the risk would be higher if both your parents develop it. Okay. And so that's why, for example, when I was in training before in Sydney, yung when we see an early onset dementia agad in an elderly parent, yung mga children nagano na kagad, nagpapa-screening na kagad sila so that they would want to know whether they have the gene or not. Kasi then you can try to do some degree of prevention in terms of being able to delay the manifestations of the disease, no? Yung mga stuff like that.
Right. So like Chris nga, I think that sort of answers Chris Rosenthal's question. If one of your parents has dementia, is there a higher chance for you to develop dementia?
Only if your parents, but again, we would need to qualify when your parents develop the dementia.
Okay.
Because as we have said, diba, pag nag-early onset yan yung familiar list. Pero kung yung parents mo, like they were in their 80s or 90s when they develop Alzheimer's, and that's what we would refer to as idiopathic. Okay.
So medyo hindi naman ganun kataas yung chance.
Yes.
Yeah, if
Hindi
you're
magiging stuck right now.
yeah, no. Okay, what are the signs, to look out for? Yung mga red flags or warning signs, let's say, that you should pay attention to. Ayan, sabi ni Sam, how can you tell po if someone is already developing dementia?
Mhm. It may be difficult kasi
Hmm.
the challenge that we have with Alzheimer's. Also, okay, just to clarify, no? So when
Yes.
we're talking about dementia here, we're specifically referring to Alzheimer's kasi
Alzheimer's.
yung
Yes.
clinical progression ng mga different types of dementias are different, magkakaiba. So just for the sake of the discussion, when we talk about dementia now, we're referring specifically to Alzheimer's.
Alzheimer's. Yes.
Yes. The onset and the development of Alzheimer's dementia is very gradual, no? And that's why oftentimes patients are not diagnosed until they reach the moderate to even severe stages of the illness.
Right.
And so that's why yung mga may early dementia, yung mga mild cases, oftentimes na overlook. Marami yan, may mga socio-cultural factors din kasi involved. But anyway, so oftentimes the symptoms may be so mild, no, and can be overlooked. Tapos people, like we were discussing off cam, di ba?
Yes.
Intelligent people can compensate din kasi, no. Okay, the earliest disturbance or manifestation of Alzheimer's dementia that we would look for would be memory deficits. Okay, especially for more recent memories, no. Kasi generally yung intact yung mga mga earlier memories nila, you know.
Yes.
So yun, so memory deficits, it can start off like harmless, like forgetting where they live, okay, forgetting where they put the keys, mga ganon, forgetting where their glasses are, okay. But again, we would need to clarify that later, okay. But so what I'm trying to emphasize is, like, in my perspective, in my practice, there are 3 sets of symptoms that I would look for. The first one is memory impairment, yun na nga, so challenges in memory, particularly for more recent events, okay. And then intellectual deterioration. So yung other aspects of cognition will be affected, like calculation, no, judgment and reasoning, yung mga ganon. No? And then the last part would be personality deterioration. No? Yung nagiging na sila, irritable, aggressive, no? Nagkakaroon na sila ng mga sexual disinhibition, okay? So, and that also reflects the severity of the illness. So kung memory deficits pa lang sila, that's relatively mild. Pag nagkakaroon na ng intellectual problems, then that would be moderate stage na. Tapos kung may mga personality disorganization, that tends to be the more severe stage of the illness. So, sa akin, in my practice, that's how I would, parang for quick screening lang para maintindihan. So in terms of the development, the first thing I would look for would be memory deficits. But again, just to emphasize, Alzheimer's disease kasi is a very heterogeneous disease. So that means not everyone will present with memory deficits first, okay?
Yes.
So just because probably hindi masyadong prominent yung memory deficits nila does not automatically rule out that the patient does not have Alzheimer's dementia. Okay. So I'm talking that from the classical perspective ng condition.
Right.
Typical.
Yeah. So in other words, if you are in doubt, and you suspect that something is off with a loved one, with a parent, with a spouse, diba? It's always best to err, on the side of best to get an assessment, right? The earlier you catch it, the better. Is that right?
Yep, right. Let me give us an example. This is a very recent case that came to me for consultation.
Yes.
Even though the patient apparently, this is an elderly female, even though the patient had very apparent memory deficits, it wasn't until that she would get up in the middle of the night to dress up to go to church that the family members thought that there might be something wrong. Okay.
Oh, okay.
So so by the time I saw the patient, moderate to severe na yung yes. Kasi nga, I mentioned earlier about socio-cultural factors, kasi sa Pilipinas, for example, yung pagiging ulyanin, di ba? Yung, di ba, when we become very forgetful, parang tanggap natin yun, that's normal part of aging.
Yes.
So that's an aspect of ageism. So, and that's the reason why hindi nadadala for evaluation yung mga nakakatanda. Kasi iniisip ng mga kamag-anak, Normal naman sa Pilipinas, sa tumatanda na nagiging ulyanin, di ba?
Di
Oo,
ba?
nag-uulyanin na. So, hindi na dadating sa doktor for for evaluation. So,
Oo.
it's not until, for example, nagkakaroon na ng, let's say, incontinence, yung dumudumi na kung saan, yung mga, unless they find something disturbing or weird with the head, tsaka na lang sila isip na baka there's something wrong.
That's true.
Kaya, and that's the reason why in my practice, for example, no, by the time I see most of my patients with Alzheimer's, medyo moderate at least moderate level na. Okay. Kaya, although may magagawan pa rin ng paraan, but the thing is, like when you mentioned, the earlier we catch it, the earlier that we will be able to apply specific treatments.
That's right, yeah. There's a question here from Judith Campos. Is it true that playing mahjong and doing puzzles, and I know dancing can prevent you from getting dementia? So true.
Well, it depends if you win or lose in mahjong, di ba?
Okay, yan. Tanong din ni Alia yan eh. I've read that reading, doing crossword puzzles, even playing mahjong, brain activity can prevent or delay Alzheimer. So, totoo nga ba?
Okay. Ganito kasi pananaw dyan, ano? Any activity that will stimulate the brain, even like doing Sudoku, crossword puzzle, even online gaming, can help the individual. One reason for that is because it activates the brain, stimulates the brain. Okay, so it may be helpful.
Maybe helpful, di ba? And then there's a lot of studies now, di ba? Especially yung sa dancing nga sabi. Okay.
Physical activity.
Physical activity. Are there vitamin supplements that can help prevent dementia?
My answer would be categorically no. Okay.
Mm-hmm.
But generally, good nutrition will not prevent, but at least mitigate or lessen the ravages of the illness. But that will be true anyway for all. I mean, physical health. No, people kasi assume that we can take this out. Like, okay, if I do this, then it can help prevent dementia. No, for example, like if let's sabi na pag-usapan na yung smoking and drinking, and as I've mentioned, and that helps not just in preventing dementia, but everything else, no, heart disease, diabetes, yung mga ganon. So even nutrition. Remember, vitamins, as what was mentioned, they're supplements. Okay, so that means they're there to supplement. But only if there is something that's lacking in your diet, okay? So let me reiterate that. Because so far, all studies naman have shown that vitamins can be helpful, but okay. We're talking about vitamin supplements kasi specific vitamins do have a function in our body. Pero kung kulang yung diet mo, then the supplements will be helpful to fill up the gap.
Right.
But if you're eating well, no, good nutrition, okay, then you probably won't need any supplements. And then generally they won't help prevent dementia per se.
Okay. You mentioned earlier the idiopathic dementia, diba? That dementia that the older people get, right?
The usual that we have, right?
Yeah, the usual. So Bing Sonsona is asking, how do you delay the onset of the dementia if your parent has idiopathic dementia?
Well, like what you mentioned, the best way is early detection and application of treatment. We have a group of medications now that can help delay the deterioration, not delay the onset, but delay the progression of the disease. No. Yes, and they've been well established by a lot of studies. No, and even in my practice, I do see that that it helps lessen or at least slow down the process.
Okay. Ses Casilag is asking, what kind of assessment is done to determine early on if a person is developing dementia? You mentioned that most patients you see are already in mid-stage development. What kind of assessment?
Well, essentially we call them cognitive assessment.
Okay.
And generally, a lot of physicians can do that. Like in the Philippines, kasi I wouldn't really call myself a dementia expert, but because dementia is just one of the conditions that I deal with. But there are, for example, individuals kasi who would identify themselves as a dementia expert. So baka naman magtampo sila. But
Okay. Alright.
but so aside from psychiatrists, neurologists also, no, and geriatricians. So geriatricians are internists, di ba, who train in
Right.
okay.
Yeah.
So at least these three groups can help identify. But in other countries kasi, the primary case identification is done at the grassroots level. So that's why we have community nurses who can actually do that. But in the Philippines, hindi pa masyadong applicable yun. So in our setting, napupunta talaga sa specialists. Okay.
Yeah, and like let's say here in our setting, if you suspect that like your parent has dementia, you would go to either yung common now is neurologist, right? Or geriatrician, or yun na nga, like you said, minsan your psychiatrist, diba? Or your cardiologist sometimes can tell you, like,
yes. Right. Even psychologists, social workers, a lot of people who are involved in mental health care will be able to help in the assessment process. No? Tapos pwede lang i-refer to a specialist for final, kumbaga, for better screening and identification.
That's right. So I have a question. Do you tell someone with dementia that they have dementia? How do you navigate that?
Right. I mean, that's a very good question. Early on when I was in training, that was, and even as a psychiatrist kasi, we always are upfront with the patient. But again, I'd like to qualify this. This is in terms of my personal practice, in terms of how I deal with not just dementia, but in overall disclosures, what we call disclosure, diba? Whether the patient has cancer or HIV positive, okay? Ang point ko dyan kasi is that in a lot of instances, each individual has some inkling about what's going on. After all, this is our body, and we know our body's better than another person, even a doctor. No, so if there's something that's going wrong with our bodies, more or less alam natin yan eh. And that's why my approach would be to explore their understanding. One of the very first patients I saw when I was training in Sydney was he was actually late middle ages, a very early onset sa kanya. He was an accountant. Then he was brought by his wife for consultation because when he got home one day, he didn't have the car with him. No? So sabi ng wife niya, where's the car? Tapos sabi niya, I brought it to the shop for repairs. Okay, ganun. Tapos sometime later, the police called up their house. Do you own this car that's been left in the mall for a week? So he forgot where he left their car. No? So that was the first inkling that they had about the fact that at the time that he possibly. So in-evaluate namin ganyan, he was seen by a geriatrician, a neurologist, and myself as a psychogeriatrician. So yun, basically he did have. So when it was my turn talking to him, he still had some degree of denial about. So I was trying to explore. So why do you think you left your car? Why do you think you forgot? So that's how I would approach it, rather than telling them directly that you have dementia. No? In my case, that's how I would do it. But the thing is, if a patient has the right to know his diagnosis, the patient also has the right not to know. Okay, because you know this, diba? Because we have different levels or varying degrees of readiness to be able to accept bad news or good news. No, so if we are not yet ready to accept the diagnosis of dementia at that point in time, then I would not push it. No? I will look for a better time, because oftentimes, diba, people develop what we call aha phenomenon, yung insight that. So let's look for that proper time. So that's why you cannot answer that question simply by saying yes, I will say, and no, I won't know.
Yes, and maybe some people are better off, I guess, not knowing.
Not knowing, kasi patients din kasi who become very devastated. And oftentimes their families as well. Kaya that's why we really need to be very careful. Especially kasi in Western countries, di ba? Alam kasi nila what Alzheimer's is, what would be on the individual eventually, at saka yung ano magiging impact nun sa mga loved ones nila. So they're all aware of that, no? Kasi they see it in documentaries, in movies, and they have all this literature. And that's why it's not simply being based on our assessment, you have Alzheimer's. No, it's not as clear cut as that. We still need to be able to sort of balance things.
That's true. Is Elisa Moran is asking, is becoming suspicious or paranoid common in dementia cases?
Oh, yes. Very, very common. In fact, sometimes it's the first, sometimes the reason why the patient was being brought for consultation. I had a elderly male patient who was brought for consultation because he had become very jealous of his wife, and they're both elderly now. Kaya the wife was so, I'm 80. Why the husband was suspecting the tricycle driver, the guard at the subdivision, the postman, that they were having sex with his wife. No, okay, yun. So of course, when I evaluated, it turns out it's actually just a symptom. Okay. Pero one of the more common forms of paranoia that we see would be yung stealing, no? Someone stealing, someone came in, no? And that's oftentimes to be able to compensate, parang form of denial, no, I did not lose my glasses, someone came in and stole my glasses. So parang defense mechanism nila yun so as not to acknowledge that there is something wrong with their memory. No? So they tend to project it to this nebulous person. No? So paranoia is very common.
Oo nga, yeah. Can depression and dementia happen at the same time?
Oh yes, true. Particularly in the early stages of the illness, no? Kasi nga naman, no, when you come to the realization that you have Alzheimer's, no, and that all these memory deficits that you've been experiencing the past couple of years is leading up to Alzheimer's, and then you're aware of how the disease can progress, then of course, people do get depressed. So like yung patient nga yung accountant na nakaiwan ng kotse niya, he was depressed at the same time, no, because he actually knew at the back of his mind what he was going through. So he was very depressed.
Yeah. Before I go to our next question, before I go to my next question for you, Chola, let's bring up, I think we have two. What is the most common risk factor for dementia? Okay. Most common, maraming risk factors, but the question is, what is the most common risk factor for dementia?
May answer. Okay.
please put in your answers in the comment section so that we can find a winner. So we talked about that just a few minutes ago. What is the most common risk factor for dementia? O mamaya niyan merong sasagot. In the meantime, let me go through some of these. Okay. After initial assessment, is it confirmed like through MRI?
Alzheimer's? No. The definitive diagnosis of Alzheimer's dementia is done at autopsy. Okay. Yes. But the disease kasi has a very classical onset and progression. Talagang hindi mo maipagkakamali sa ibang forms of dementia, no? Kasi pati yung manifestations niya. Pero siguro, for example, like vascular dementia, makikita sa MRI or CT scan. But one of the sort of consistent findings that we know is that Alzheimer's, basically, mga neuroimaging tools would not be able to establish a diagnosis. Kaya meron kaming presumptive, no definitive, no. So we really totally base it on clinical manifestations.
Yeah. Why Leah is asking, why do people with dementia, quote unquote, see people and things that aren't there?
Okay. So just to clarify, you see things that are not there. Ano naman yun, misperception, so it is very common, but that usually may happen at the later stage of the disease, no? Pag mga moderate to severe, okay? And I have a lot of patients. In fact, when I was in residency training, one reason that I got interested in geriatric psychiatry because one of my very, very first patients was an elderly female. No? Again, she was brought in kasi may mga nakikita. Ito, elderly female na very weak na kaya siya dinala sa ospital kasi tumakbo siya palabas ng bahay at saka nakaakyat ng bakod in her, at her age. Because because kasi may nakikita daw siyang may pumasok daw sa bahay nila at gagawan siya ng masama, okay? And nung inassess na dementia basically, okay? And again medyo late stage na rin siya. So yun, so that can happen, but again, you generally happens at the later stage of the illness.
Later stage of the illness. Okay, Doc, my mom who has dementia is always looking for her dead siblings. Is it better to remind her that they have passed away or just pretend that they are in their respective homes?
Ganito yan eh. You don't have to. I mean, you just ask why. Why is she looking for them? Okay. Because remember, their attention span then, their concentration can be very short, no? Can be transient na to the point na oftentimes you don't have to deal with it kasi makakalimutan nila din maya-maya.
Right.
If that happens, just ask them why. Kasi remember, di ba, in Alzheimer's dementia, mas intact yung remote memories. You know? So that's why they can remember, and that's why they're looking for dead relatives. In fact, one strategy then among dementia homes in the US, I mean in other countries, they take out mirrors, okay? Because it can be very disturbing. Kasi, di ba, when you have dementia, particularly in the late stage of the illness, your memory of yourself is when you were young, no?
Yes.
So that if you look at the mirror and you see this very old person there, that's so, who's that? Di ba? Kaya that's why they recommend in dementia care homes in other countries not to have mirrors so that the individual doesn't get very surprised. So if they start looking for mga relatives from long ago, yun na lang, just explore why. Okay. In fact, one therapy that we recommend is what we call reminiscence therapy, and even life review process. In reminiscence therapy, just talk about the past, talk about the past that they can remember. Yun lang, just talk about it. So, for example, like if they remember Elvis Presley, talk about Elvis Presley. What were her favorite songs na kinanta ni Elvis, yung mga ganun, or Perry Como, yung ganun, mga ganun. Ganun, kasi that there are two benefits there. Una, it's self-reinforcing, di ba? Kasi remember, someone who's losing a lot of memories will feel good that they have things that they can recall and remember. Okay.
Right.
And at the same time, it's distracting then. So it helps them not to dwell on the negative aspects if you bring up the more positive aspects of their memory. So.
What about looking at old albums and old pictures?
Yes,
right? Yeah.
That's good. Oh, very good. That's excellent. In fact, there's an app in the States. They put in the cell phone or tablets. It allows let's say the child, the son or the daughter of the patient with dementia to input pictures from long ago. Pasok doon. So that, pag medyo disturbed si nanay nila, then they can just open the app and then scroll through. Okay. Tapos parang kasi you can apply it, so you can pwedeng ipasok mo lang in one phone and then you can access it by cloud in other devices, so you don't have to download everything. So yung mga yes. So yes, old pictures, old albums, okay.
Music also, di ba?
Oh yes. No, music. Yes. But of course it has to be something that they remember and like of their generation.
Of their generation. Yeah.
I remember kasi when I was working at the National Center for Mental Health, and I was handling the geriatric units. Kasi every 2 weeks, may mag-rotate yung mga student nurses. So nung bago ako doon, nakikita ko yung mga student nurses, part of their socializations with the patient. Sometimes they would play Britney Spears, mga Shakira, gano'n. Tapos yung mga patient, mga elderly patient, nakaupo lang gano'n. Tapos they would, the students would encourage them to dance. Siyempre, sabi ko, suggest ko, no, don't play those stuff. Sabi ko, because they don't know those music. Sabi ko, play something like Chuck Berry, like let's do that twist. So when they started doing that, then that's when the elderly patients got involved. Kasi nga, di ba? may recall sila about that eh.
They're familiar with that.
Yes, exactly.
I have a question. It has to do more with the people who take care of patients with dementia. Ambiguous loss. You experience a lot of ambiguous loss when you have a family member, di ba, who has dementia. So, how do you deal with that? Kasi mabigat eh, di ba? Mahirap. It's very painful when you see them like starting to fade essentially, di ba? And then it comes to a point when they no longer remember you. So as the carer or as the family member, how do you cope with that, deal with that?
Actually, mas maganda kung ikaw sumagot yan kasi natutulan ko lang naman yung sagot sa iyo. Kasi di ba yung we focus on who they are, di ba?
Yes.
Rather than on what we're losing, but essentially remember who they are or even who they were, and let's keep that in mind. For example, like were they great parents, were they loving parents? Yung focus on that kasi but of course we can't avoid kasi siyempre we're humans, we can't avoid looking in terms of what's changing. Kaya lang, but the thing is, if we focus on that, it prevents us to better help them. Kasi diba, we're dwelling on the negative, So, but focus on who they were and what they have contributed, diba, what they've done, what they've accomplished, because that will further motivate us more and realize that what we're doing in terms of helping them is something that's worthwhile, diba?
Right. I remember you told me something before na they're still in there somewhere.
Yeah, yes.
Diba?
Somewhere.
You told me that. Yeah, they're still in there somewhere. So,
but that's not my original idea. I just learned that too.
Yeah, but it's hard if you're caring for someone with dementia. It's like a daily choice, diba? That you rise above it. You rise above it, diba? Kasi it also can be draining. So it's really important to take care of yourself as well, right? Otherwise, which brings me to an important question. But I think we have one more question, ba, Cholo, before we go to our last two questions for Doc Bong. Okay, true or false? Everyone will get dementia at some point in their lives. True or false? By the way, ang previous winners of the last question is Gianelet and Bing Sonsona of the previous question. Now, this one, sino? Pag nanalo na kayo dati, Okay. Ella Rivera. False. Tama, di ba, Doc Bong?
Sorry.
Ano nga yung question?
I wasn't paying attention.
Not paying attention. Ayan, false. Okay, Cholo will tell us later who
false. Right.
Yeah, who won it. Ayan nga, sabi ni Dr. Malumagno, who by the way, said hello, I think you were schoolmates. Dr. Malumagno, caregiver burnout is a challenge. Are there programs to help caregivers? Locally, are there programs to help caregivers? Parang wala yata.
Yes. The help that we provide to caregivers is what we call respite care. Okay.
Yes.
So may term talaga. Kasi there's a recognition for that. Na, the caregivers need to be helped as well. Because they are the individuals who are taking care of the dementing adult, so therefore they need to be assisted as well. I mean, any caregiver, whether they're taking care of someone with dementia, taking care of someone with schizophrenia, any caregiver, is worthy of. Yes, I would think that yung mga organizations like yung ADAP, Alzheimer's Dementia Association of the Philippines, yung Dementia Society of the Philippines, and even mga hospitals, for example, may mga patient groups din. I'm sorry, family groups, di ba? Yung mga ganon. So, yes. So, they can assist as well. This not only in terms of providing respite, but also in terms of providing information. One of the most critical steps kasi of what we do is we provide what we call psychoeducation. Kasi nga, di ba, like in the Philippines, marami tayong maling kaalaman about dementia. Okay? So the first thing we need to do is to correct all those misconceptions and give the family members a good idea. Kasi I get family members who come to me upon first consultation na galit, naiinis doon sa pasyente, no? Kasi they think na sinasadya ng pasyente yung ginagawa niya kaya pinapatulan nila, no?
Hindi
Kaya
naman
I need to explain to them that the patient with dementia is not responsible for their behaviors, no? And they're not doing it intentionally to insult you or to hurt you. It's just something that happens, no?
Exactly.
Kaya tapos ang nangyayari tuloy and this leads to what we call elderly abuse. Kaya nasasaktan tuloy yung nakakatanda, di ba? Sometimes ikukulong nila, itatali, yung mga ganon. Or sometimes they'll deprive them of food. Sabihin, parang parusa kita pag hindi ka nagtumino, hindi kita, no?
Or sisigawan, di ba?
Sisigawan. Exactly, you know, yes.
Paulit-ulit ka, nakakainis ka na, di ba? Di ba, katatanong mo lang yan sa akin. So that's like really hurtful.
Yes.
Yes. Okay, one last question. At what point should a Alzheimer's patient be given full-time care? At what point in the journey?
Ang pananaw ko dyan would be as early as possible, as early as you can. Why? Because you need to have the caregiver get to know the patient, di ba? Kasi that if they can have a parallel journey.
Yes.
Kasi for example, kung papasok yung caregiver at the later stage of the illness, yung hindi niya kilala yung pasyente, na mabibigla siya, lalo na kung medyo nagkakaroon na ng what we call behavioral and psychological symptoms of dementia. No? They become very aggressive, irritable, nagkakaroon ng mga hallucinations. So, ang suggestion ko yan, earlier on pa, so that they can, get to know each other, so that the caregiver will know, this will help calm her down, okay? These are the stuff that she doesn't like. Kasi for example, when you talk about ABCs of behavioral management, may mga triggers yan eh, no? So, I mean, the patients with dementia don't just become irritated.
Right.
No, I mean, usually something will trigger that. So if you have a caregiver who knows what can trigger the irritability of the patient, then that's great kasi magagawa niya ng paraan eh. May iwas niya. For example, if it's too cold or too dark, yung mga things like that, then mamamodify niya. Pero kung bigla mo na lang ilalagay yung caregiver pag medyo moderate to severe na, tapos hindi pa siya kilala nga nung pasyente, then that can be very challenging. Pero again, only if it's feasible, no? Only if it's feasible. But ideally, as early as possible would be great.
Right. Doc Bong, grabe, what a conversation, okay? And that we can go on and on and on, but
right.
My gosh, thank you so much for your time. But any final words
right.
For families, for families with loved ones who have Alzheimer's?
Right. For families who have loved ones with Alzheimer's, and if you're taking care of them, then the first thing I would say is I salute you and I admire what you're doing for them. And that I hope that with God's graces that you will be able to have the forbearance and patience to continue to look after them and care for them, because that's something that they wanted to have for themselves. And the challenge is because they may lose awareness of what's happening, and they may not be able to thank you, but somehow that they are grateful for the help that you are doing. Okay, so just remember that and just be steadfast. And just a little thing, kasi bigla lang pumasok sa isip ko because someone asked about vitamins and supplements earlier. Kasi technically we have something like ginkgo biloba. It's technically a food supplement, and studies have shown that it is helpful. And in fact, it can be prescribed. Okay, but that's the only thing that I can think of right now. But because there have been studies to prove that. But in general, again, not necessarily helpful or preventive. Okay. Yun lang. I don't know, biglang pumasok sa isip ko.
Thank you so much. Wait, pwede magpahabol na question. Huling-huli na lang.
Sure.
And I ask this of all our guests, okay? And as a mental health professional, and your own personal, from your own personal experience of the pandemic these last 6 months.
Right.
Okay. If how has this How has this whole experience changed you?
Me, uh, well, a lot. There are aspects of it that I'm grateful for. There are aspects of it that that I'm not grateful for. But it has made me I don't, it's actually been a very very busy time for me, you know. Simply primarily because, as you know, diba, there's been a huge demand as
Yes,
far as because of the impact of COVID on a lot of individuals, diba?
yes,
Increase in anxiety and depression. So naging malaki tuloy yung pangangailangan for mental health care professionals to be
right.
able to help them now. So that's why it's been yun ang isang naging impact. It's been a very busy time for me.
Mhm. Yeah. What's your greatest learning? What's your most important learning from the last 6 months?
That we can fight through adversity. Okay. But I don't want that to sound like it's a blanket statement. And I'm talking about that like because your question is direct. Siyempre, I'm talking
Yes,
about that from my personal
yes, from
experience.
your
You know,
personal
that
experience.
yes, you know, that w- there will be a lot of challenges. You know, and then there will be times. There was a time that, you know, everything felt so dark and
Mhm.
gloomy because, as you know, diba, I lost my mom recently, and
Yes,
you know,
yes,
and it but one just needs to be able to go through that and bear that, and then, you know, make a realization about, you know, that when you lost someone, that, you know, in my mom's case, kasi she did go to we felt I felt that she did go to a better place, and that, you know, um her death prevented her from suffering from a lot of pain, yung mga ganon. So, and that's why it was a little bit easier for me to accept that. But still, you know, it at that point was very difficult. But I'm fortunate, of course, because I have a big family and we supported each other. We helped. I had a lot of friends as well, and then you were very sympathetic as well. You know, kaya, you know, yun. That's what I would say.
yes. Thank you. Thank you so much. Sobra overtime tayo ngayon, pero maraming salamat. Grabe. This is like, or you know, this is like our longest episode ever. So I told you, naku, pag tayong dalawa, wala na. Kahit kaya pa tayong hating gabi. So, yung rest, it's been, oh, thank you for your generosity. Sobra.
Yes,
Maraming.
okay lang.
Doc Bong, thank you. Thank
Maraming
you.
salamat din, Cathy and Cholo. Thank you very much.
Thank you so much. Thank you. Thank you for, you know, for staying with us. But we have a little more, so please don't go away.
Conversations with Cathy.